Welcome to Dentistry and You. I'm your host, Dr. Casebolt. Tonight, I want to talk about a very important subject, something that's very near and dear to me, the future of our civilization, our children. With me tonight is Dr. Glen Hemmburger, a pediatric dentist, that is, a dentist that specializes in the treatment of children. Glen, welcome to Kansas City Alive.
Thank you, Buford. I'm glad to be here.
Oh, that's super. You know, I can't think of a more important topic. Our children do form the basis of our society. All our future goals, everything that we want to see in society is based on that most precious commodity, that precious resource, our children. And tonight I want to talk about some of the aspects about children's visits to the dentist. And again, I want to remind our public out there, our viewing public, that this is a call-in segment. If you have small children at home or children that maybe aren't quite so small, or if you have questions about children's dentistry, give us a call. Love to hear from you. Glen, one of the things I wanted to talk with you, a child's first visit to the dentist, of course, is the most important visit because that formulates their attitudes that will follow through with them for a whole lifetime of good dentistry and good attitudes about dentistry. What can you tell us about what a parent can do to help prepare their child for that first important visit?
One of the biggest problems with a child's first visit is fear. And a child is not naturally born afraid of going to the dentist. Most fears are attributed to things the child hears at home or at the child's peers. So parents should be particularly careful not to relate their own dental fears. Do not talk about bad experiences of their dentistry in front of their children. They do this without even realizing it when the child is very young, but the child hears and the child remembers. In addition, never threaten a child like, if you're not good, we're going to send you to a dentist. Now that may seem funny at the time, but the child remembers that.
They're very impressionable.
Very impressionable indeed. Another thing is, never, if it comes time for the child's first visit, don't bribe them. Now, if you go to the dentist and you're real good, I'll buy you a toy, or we'll stop and we'll get a treat. Well, if it's so bad they have to give them a treat, the child picks up on this very quickly. In addition, don't wait until the child has a trauma or has pain to bring him into the dentist. How can a visit in which the dentist must do a lot of traumatic work or has to treat a toothache, how can that be a good visit?
I think that's an excellent point. Especially with small children, they see the world, they're looking up. Everything is up there, and big machinery, big equipment. They're in an environment that they have not been used to. And children, I don't think they're born fearful, I agree with you, but they look at the world as a very big place, and they rely very, very heavily on their parents for those very subtle little cues about what to expect next, where they're going, what they're doing, all the things that are important for their behavior. And I think that's an important point. As a pediatric dentist, what do you do up and above what I do as a general practitioner? What do you see and what do you do a lot in pediatric dentistry?
You mean as far as treatment goes, or
yes,
as far as treatment? Well, of course, what you like to be is a preventive dentist.
Right.
You know, if you can prevent pain and But in early stages, we watch for cavities, of course,
sure,
and teach the child how to take care of their own, and have tried to provide a very good dental visit. Okay, as a child develops and start losing teeth and new ones start to erupt or come into the mouth, we watch for the alignment of the teeth. In other words, how straight are the teeth going to be?
Exactly.
Is there something we can do early that may prevent more of a problem later on?
So there are interceptive things that
there are interceptive things in many cases, not in every case, but in many cases. And the dentist really, if a child does not come in, of course, this cannot be evaluated. Right. Regular visits, we cannot emphasize, a child's mouth is changing constantly. Regular visits are important.
I think that's probably the most important thing. And I would like to remind our public, our viewing public out there, this is a call-in segment. If you have a question for us, we would love to hear from you. You know, Glen, one thing that did surprise me, something I didn't know, and we talked about this last Saturday when we viewed some of the tapes and some of the things that were going on at the time, we talked about this, was about toothbrushing techniques and methods for children. I, of course, realize, and most people realize, that the water is fluoridated in Kansas City, Missouri. But what I had not realized is that, and as per your suggestion, is that you don't necessarily need to load up a toothbrush with a lot of toothpaste necessarily for a 2-year-old child experiencing their first brushing techniques. What do you recommend our viewers do about taking care and helping taking care of their children's teeth?
Well, first of all, any young child, let's say a child below the age of 4 or 5, brushing should be either done by the parent or supervised by the parent.
Right.
At least before the child goes to bed at night. Below the age of 2, I really do not believe a child needs toothpaste at all.
They swallow it.
They swallow it. No child below the age of 4 or 5 can spit toothpaste out. They simply swallow it.
Tastes good.
Tastes good. The manufacturers have made it even sparkly now, so it looks good, you know. And many times in the advertisements, and some of the advertisements, do promote dentistry very well, but the toothbrush looks like an ice cream cone when they get finished with it.
Right.
Below the age of 4, anything larger than the size of a pea is really too much toothpaste. It is the brush that does the cleaning.
Right.
What happens is that there is a proper amount of fluoride in the water, and during the early ages, that is from birth to about 4.5 to 5, the permanent teeth, even though you don't see them, are forming. And extra fluoride can cause the color of the teeth to look marbled, particularly in the first year or 2 of life.
I see. That's an interesting point. So basically, the amount of fluoride that we have in the drinking water is at the proper amount, and we really don't need to give our young children any more than what they get naturally through fluoridated drinking water.
That is correct. Now, we're talking about systemic fluoride. That is fluoride they swallow.
Ingest, right.
And that is what and the problem with small children is they do swallow it. That doesn't mean that if the dentist wants to give fluoride treatment, that is a topical fluoride that is applied to the teeth in the mouth.
Right. You know, we have a model here. It's one of my favorites, as a matter of fact. It really very nicely depicts and shows the development of young children's teeth as they go basically from, I want to say, newborn to 6 months, perhaps, onward up through adulthood, which we'll see right here. Glenn, what can you tell our public about this model and what maybe our people at home with small children might expect as their children grow up, and what they might expect in their mouth with their teeth?
Well, as we look, what people really don't realize is this first model here is a child at birth. And what you don't realize is this is the gum level right here, and the bone level actually. And of course, this doesn't show the gums; it's just a skeletal model. But how many teeth are actually present, and how far they are present? Now, these are all baby teeth right here, but at this particular stage, the permanent teeth start to form. And so the health of a child and the nutrition of a child from an early age is very important.
Permanent teeth are developing really at the time of birth.
At the time of birth, permanent teeth start to develop. That is the very front ones, and that is the incisors, and the 6-year molar, which of course forms back behind the baby teeth.
When would a parent expect their child to receive their first teeth? Probably their central incisors, obviously the front ones. I get a lot of questions about that.
You're talking about baby teeth?
Baby teeth, the primary teeth, baby teeth.
Okay. Well, normally, the average age is around 6 months for the lower baby teeth to erupt. However, they can come in as early as 4 months, and I have seen them as late as 18 months. And now a parent gets a little concerned after 18 months, whether or not the teeth are even there. But for that child, it's normal. So we get a lot of questions about that constantly.
I could see that would be very, parents are concerned.
Sure.
They can't figure out why their 6-month-old child has not received their first teeth, whereas some children, they receive them at the time of birth, and sometimes go as far as a whole year. There's a lot of variability with children. They are little individuals, and they have their own individual development. Now, this second model, we go quite a bit further on into the future. We're looking at, I'm going to estimate, about, 2 years?
This particular
year and a half
here. Looks like the permanent teeth are forming fairly well under here, and this one here is probably around the age of about 5. This is close to 5.
Okay.
At the formation, because the permanent tooth is just below, the 6-year molar here is just below the gums.
Okay.
One of the questions we get very commonly is, when will my child lose his first tooth?
Right.
If a child, generally speaking, gets his teeth early, generally speaking, he will lose them early.
I see.
Now, that doesn't always follow true, but generally speaking, it is. Now, the permanent teeth, which are behind in front here, the permanent teeth are behind the baby teeth in front.
Right.
They are quite formed, even though we can't see them here. And when they come in, they generally come in on the inside, that is toward the tongue.
Right.
And many times when they come in, the baby teeth can still be there, and parents get pretty concerned about that.
Right.
There's a lot of questions. This is the reason why they should bring their child in regularly to the dentist and ask him.
I think that's an important factor. And I would say, again, to our people at home, our parents with young children, that those first visits to the dental office are so very, very important. That attitude that is fostered in our young children carries through a whole lifetime. And that's what this whole thing is about. And again, if you have a question for us, please give us a call. The phone number should appear at the bottom of your screen, and you can talk with either myself or Dr. Hemmburger, Glen, about anything involving children's dentistry. We'd love to hear from you. Glen, as we move ahead, again, we're looking at more permanent teeth here in place, and I can see a permanent cuspid that's not yet in place. They call them canines now. Again, the development's moving right along. What will our parents be expecting now in their children?
Well, at this particular age, it's pretty interesting in that we have the front permanent teeth in, generally speaking, and there is about 2 years that occur generally between when the front incisors are lost and the permanent ones come in, and when the back baby teeth are lost. And many parents forget their baby teeth. It's the most common things. And we get many calls asking us, why is that tooth loose? Is he going to lose his permanent, or is Susie going to lose her permanent tooth early?
They're frantic.
They're frantic. And we say, no. What age is your child? No. Is it loose? Yes. Well, it's a baby tooth. Believe me, permanent teeth just don't get loose.
Right. You know, another thing I think is important to mention, this year, and it seems like it happens every summer, I always receive a number of emergency calls from patients. A child has fallen down whilst running around the swimming pool. Bicycle accidents are very common. Sometimes they just bump heads on a playground. A tooth is lost. And a lot of times we have to determine, is it a permanent tooth or is it a baby tooth or a primary tooth? Glen, what would you tell our viewers at home with young children, or I should say not so young children, that have forming permanent teeth that are in the process of erupting into the mouth, let's say age 6 or 7, maybe age 8, and they have evulsed or they have had one completely knocked out? What would you tell our viewers in terms of what they should do for their emergency care of their children at this time?
Okay, if your child or some other child on a playground or anywhere loses a permanent tooth, is knocked out, this is a very traumatic time for everybody.
Of course.
And trying to remain cool and keep your thoughts together is the most difficult thing. But the first thing you should do if a permanent tooth is knocked out is to place it quickly back into the socket and then get him to a dentist as quickly as possible. Now, if several are knocked out or if it's too bloody and they cannot tell where it's supposed to go, cold milk is second best. This is what at least is now recommended. It may be a far second, but it is second best. Most people can get a hold of cold milk. I don't care, whole milk or skim, it doesn't matter. Cold milk. And get them quick to a dentist because it should be reimplanted. Time is of essence, but if it's knocked out, the more quickly you can get it reimplanted, the better.
Well, Glen, I think that's a real important point, and that might be good advice for our viewers out there, especially with maybe not so young children that are very active. And again, I want to emphasize the importance of good attitude and making those first appointments, those first visits to the dentist, a very positive visit. And again, I want to thank you for watching Dentistry and You. I'm your host, Dr. Casebolt, and thanks for watching Kansas City Alive.
Stay tuned. When we come back, you'll find out what's on Wednesday's Kansas City Alive.